Hey. Okay, so I'm Manrit Kaur Takhar. I'm a psychiatrist based in Calgary. So I originally finished my medical degree actually in my hometown, Winnipeg, at University of Manitoba. And then I came out here for residency within psychiatry and I've stayed. I'm in my 6th year of practice. So I do both inpatient psychiatry and emergency psychiatry, along with doing a little bit of work in outpatients at the Northeast Mental Health Clinic within Calgary. My areas of interest within psychiatry are cultural psychiatry, psychodynamic psychotherapy, physician wellness, and kind of always advocating for physicians. I do hold a couple of leadership positions, as Muriel kind of mentioned. So in October, I became the president for the Calgary chapter for the Federation. Which has been great. Unfortunately, we can't, as you guys are all aware, do activities as we normally would due to the pandemic, but we've all kind of modified and adjusted accordingly. I am looking forward to when we're going to be able to do things in person, and hopefully either by the end of this year or next year, we might be able to resume some of that. So for tonight, what I wanted to focus on was mental health. The national board had asked if I could do a talk on mental health, and I felt that it would be a great opportunity to really talk about the survival kit, more so because at that point I was actually in the process of adjusting my own survival kit. So I felt that it was relevant and something that would be relevant for many of us, because we constantly are adjusting kind of our coping skills, our survival kits, our support networks, as we're meeting the demands of not just our work life, but also our personal lives. Okay, and that'll take us right into the talk. So 1 second, I'm just going to start sharing. Perfect. So this was a couple of like images and quotes that had just caught my attention in the last kind of 6 months. I really like the one where it's the various shapes of women, various ages, ethnicities, and they come in the shape of a heart. That one just really, I found to be something that kind of hit me, and that's so true that we, as I feel as women, we are strong as hell. And then the quote that every successful woman is a tribe of other successful women who have her back. And I can't emphasize that enough, especially within medicine. And for me, it is those female colleagues around me, whether they're physicians, nurses, social workers, just us working together as a team makes me a stronger physician and a stronger individual overall. All right. My disclosure slide, I will be receiving an honorarium from Otsuka tonight. Thank you, Otsuka, for being able to sponsor today's event. Okay, and as you guys know, I've already covered what I do. Perfect. The objectives that we're going to kind of focus on today are all going to transition into one another. We'll kind of start off with resiliency and burnout, then go into the stigma that we have as physicians, even with assessing treatment, then move right into being able to address depression and anxiety symptoms, and moving right into a supportive network and resources. My hope is with all of this, we'd be able to look at creating our own survival kits. Okay. I'm gonna ask you guys to take about 30 seconds to just write down your own survival kit for yourselves, because I'm hoping that with the talk, we'll be able to build upon that. Just gonna set a timer for myself to allow you guys in 30 seconds. Okay, there goes my timer. So that was actually very purposeful why I also timed that and wanted to do that twofold. One, it's very relevant to the talk because we're going to talk about the survival kit. But secondly, I wanted to demonstrate a transition zone. It is so important that when we're moving from one task to another, that we do take the time to sometimes transition, especially transitioning at the end of our workday when we're back in our home environment. How do you transition? What are some of the things that you do? And just to be mindful, whether it's 30 seconds, a couple of minutes, whatever you need to do to reset yourself, to now refocus yourself away from the responsibility you've just left to resuming other responsibilities in your life. Okay. First things first, resiliency. So the definition of resiliency, it comes in many ways. Some people refer to it as, bouncing back, the ability to adapt, being able to, for a substance or an individual to spring back into shape, to be able to recover quickly from difficulties that you might be explaining, speaks to your inner toughness. Now, resiliency is a word that most days I feel that it's very relevant for us. And then other days, I almost don't want anyone to say you need to be more resilient, because I feel as physicians, sometimes the focus is that somehow we really have to consistently be the resilient ones in healthcare. So within resiliency, it's important to think of it as a spectrum. It is an area, it's a trait that we all have. Most physicians, most individuals that work in healthcare are resilient individuals. It's how we shape it over time as it's being kind of badgered by the other factors that are being thrown at us, the demands, the fact that we don't have access to more resources, but more is expected to us, of us as physicians all the time, that it's important that we're then taking care of ourselves, paying attention to our resiliency, and sometimes nurturing it and growing it further when it needs to be, but then also being able to say, like, this is a firm boundary of no, and I'm not going to be able to take this on. I don't know if you guys are familiar with the poet Rupi Kaur. She's published a couple of books in the last, I believe, 3 years. And this was something that to me really resonates, that we all move forward when we recognize how resilient and striking the women around us are. As physicians, we work in team settings. Majority of the time we work in team settings, and we are reliant around those around us to really enable what we do. And that also includes our patients. So it's not just your team members, but also the patients that you work with. Burnout. I'm sure everyone on the talk is familiar or at least has heard about burnout. So burnout, simply put it, is just extreme exhaustion under stress. Same with resiliency. I would say look at burnout as a spectrum. So you have kind of like no burnout all to the way where it's severe burnout, right? So you kind of got mild, moderate, severe, and then danger zone. It's important we look at the concept as a spectrum because it's our responsibility to be responsible for ourselves and our health. So that means to be able to pay attention to where am I on the scale? What do I need to adjust? If I've noticed I'm going into moderate burnout, more into severe, what do I need to adjust to be able to bring things down? Our bodies are very amazing. They give us all sorts of signals when they are under stress, whether these be emotional signals, physical signals, the fact that you can't sleep. Our bodies do communicate to us. It's important to us to actually listen to them and to monitor where we're at. And not only that, the reason we got to monitor it is when we're burnt out, others around us know and they're able to pick up on it. So signs of burnout. So some of you guys may have experienced these symptoms. I certainly have experienced some of them. Most common one that you'll see is actually People being irritable, they're noticing that they have more, oh, I'm just gonna allow a couple of other participants in. Sorry about that. Okay, so people being irritable, noticing that you're having a bit of a shorter fuse, you're feeling a bit more frustrated. That's a very common, like, earlier sign if you're noticing that for yourself. Other things can be where you're just not able to concentrate the same way. You're kind of like not on your A game, and there's a bit of fogginess. And this is accompanied by a lot of fatigue and exhaustion, not feeling connected fully to yourself or to others around you, finding the sense that, oh, I'm actually like overwhelmed. Things that wouldn't normally put me off are actually now overwhelming for me. With that, sometimes we can actually engage in maladaptive coping skills. We can look at people like overeating, end up using more substances, drinking more alcohol. We can experience more anxiety, more interpersonal tension with others, and also an intrapersonal angst. And when we kind of get to the angst piece, unfortunately, that can also lead to a lot of negative talk. I'm sure you guys have seen this logo in various forms. It's been pretty popular. It's on t-shirts as well. And I think it's so important that we can remind ourselves it is okay to not be okay. We have permission to be human and to experience stress, experience burnout, and to actually take care of ourselves. And we can take care of ourselves before the burnout is extreme, or just even when it's mild. We have permission to do that. Unfortunately, we are part of a profession that does not do a good job of taking care of itself. I do believe it is doing a better job these days compared to previously. So I'm just going to bring kind of some facts from the Canadian Medical Association. They last did a physician health survey in 2017, and the report was printed in 2018. So some salient points that had stood out to me were that women are 43% more likely to report low resilience compared to the male physicians. I thought that was interesting. And then the areas where they reported kind of the low resistance, they also reported higher rates of burnout, depression, and lifetime suicidal ideation. This survey, by the way, also included residents in it. And it was noted among the population, the residents were the ones that reported the most burnout, depression, and lifetime suicidal ideation. This leads right into that next piece, actually. So the study actually also showed that the highest time of kind of burnout and experiencing low resiliency was during the first 5 years of practice. When I thought about this, I was like, that actually makes a lot of sense, because there's a lot of growth that takes place within the first, 12 to 18 months of practice. You're coming out of a sheltered environment where you've been a student for at least 10 years, right? Like if you look at undergrad, medical school, and then residency, those years add up, and you're kind of in a protected environment, you're in a student role, there's a lot of studying, exams. It's like you've been conditioned during that time to behave a certain way and to be really a student fully. And then all of a sudden, it's like you pass your exams, you have a job, and they expect you to function as an attending from day one. That's a huge transition for us to go through when we become attendings. And that transition can take that first 12 to 18 months to feel confident. People talk about having the imposter syndrome. It's a very true thing. I remember going through it 6 years ago. I'm sure some of you guys also tonight might have experienced that when you initially transitioned from a student into finally being an attending. So to me, it makes sense that the first 5 years would be probably the most stressful, where you're fully transitioning away from a student. You're the one that's now responsible, and patient liability is fully on you. And those are big stresses to be taking on. This study actually also showed, this part I was a bit intrigued by, that those that are working in a hospital setting actually have, more burnout and depression. So they're actually reporting kind of a lower psychological well-being and a lower emotional well-being. And I was thinking about, what would be the factors that partake in that? Because the study didn't necessarily highlight the factors. And as I thought about it, I'm like, okay, well, I guess in a hospital setting, we don't have the same autonomy at times. You're not the one that necessarily gets to make the decisions when it comes to how some of the resources are used, how the teams are structured, even how the beds are moved, or when you're going in surge and you got to move from emerge right into a bed situation. So I felt that, I wonder if that plays a role, because physicians don't have the same autonomy, nor do they have the same decision-making voice with the higher ups or the administration when it comes to a hospital setting. So on the CMHA, on the Canadian Medical Association website, they actually have this really nice poster that's made that talks about the key factors for women in medicine in regards to burnout and depression. I had gotten an image of it, but it kept on coming out blurry. So then what I've done is I've just quickly adapted it and made this chart. So the top 3 factors that females were able to identify that were contributing to burnout, depression screening, and suicidal ideation. Number 1 was dissatisfaction with the career. Number 2 was not having a balance between their work life and their home life. So it was actually highlighting where the work life took over more and left people completely exhausted to have actually a home life. So that balance. And the other things, this desire, and this is, I think, of something that as physicians we can really work on, is showing up and working even if you're distressed and ill. I think we sometimes take on this warrior mentality or this soldier mentality a bit too much, that where we are contributing to our poor health at that point. Now, other factors to also watch out for is that when there is dissatisfaction with the resources that individuals had to work with, and this speaks to those within the hospital setting. For females that had realized that they were drinking more than 5 alcoholic drinks in a setting, that was another factor to watch out for, because then those are the ones that were also experiencing more depressive symptoms. And then how the team works together. So having low collegiality among the staff did contribute to a higher perception of burnout. Feel free to check out the Canadian Medical Association. You can see the full study there, and you'll be able to see the lovely kind of 1-page chart that they have for this, which I did my best to try to capture the salient points. Oh, sorry. For those that have their cameras on, how many can say that this resonates with them? Yeah. And that is okay. I think when we're in the student mold, we get so conditioned that we need to have accomplishments and goals and we need to meet them. And as soon as you're done one, there needs to be another one. Whoa, we can all step back, take a breath, slow down. That is not our purpose in life, just to constantly go, go, go. But there's a lot in life and society that conditions us that way. So part of the journey about creating your survival kit is to gain awareness into some of the conditioning that's happened and what you can kind of challenge, slow down for yourself, and some things you might decondition altogether over time. It's not going to happen overnight, but over time. Right. Ooh, stigma. Oh man. It was actually interesting reading the various articles on stigma kind of within the last few months. And I feel like we have not done it justice because our own stigma is getting in our way for us to be able to explore stigma at a higher level, unfortunately. So stigma, when I was looking at the definition, so basically, if you kind of do the Google definition, it's the mark of disgrace associated with a particular circumstance, quality, or person. How we overall in mental health and in society view stigma is when there's basically a negative, when someone is viewed in a negative way because they have a characteristic or a personal trait, so it could be an illness, that is thought to be a disadvantage. Stigma can lead to discrimination. It can lead to exclusion. It can lead to a lot of internal angst, okay? Because we as individuals, especially as physicians, we play a role in perpetuating and enabling stigma within our medical cultures. There has been a shift within the last, I would say, kind of 5 to 10 years, where there's a lot more attention that we're human beings, we're going to have physical ailments, we're going to have mental health issues, and it's okay to have those and to be able to discuss them with, with those that you're comfortable discussing them with. But we are human beings first. But unfortunately, we get cultured within the medical profession in such a way that we do enable and perpetuate more stigma. It's only within the last 5-10 years that I would say that the medical associations and the medical schools are actually actively focusing on physician wellness. And they're starting it within the medical schools. And that's absolutely where it needs to start. Because my next slide is going to show a bit more. Why is it that we don't access help? There's so many reasons. So I tried to summarize, pulling from a couple of different articles. Shame and embarrassment are the number one reason in whichever article you look at. People feel ashamed for whatever ailment that they might be struggling with. Feeling embarrassed. Unfortunately, they'll see themselves as, I'm somehow weaker. They will actually rationalize that their situation is not severe enough to warrant attention. They would not do that to a patient, but they would easily rationalize that for themselves. Sometimes people don't access help because they don't know that services are available. I would say that the last few years, there's been a lot of work done around this to highlight that services are available, whereas 10 years ago, yes, that was a true disadvantage. There's a lot of fears around how is it going to impact my standing with the college? How is it going to impact my license? So people do become fearful of not wanting to disclose because they'll think they'll have restrictions. Sure, there are some cases where certain things have led to restrictions, but there's actually more cases where being open and having disclosed just meant that, sure, it's been marked anywhere, but it hasn't restricted you from your practice. Now, this one is interesting, but the whole concept that somehow you're an impaired physician, you're a broken physician if you have some sort of ailment. That is such a difficult myth for us to bust. Later on, when we're going to kind of do the question and answer period, I would love to hear ideas on how we can actually bust that myth that then you're somehow broken or you're impaired. And I have no idea how our minds have come up with this cognitive distortion that our health then is linked directly to our medical competency. Those things do not equate, but that is a cognitive distortion that we continue to perpetuate. The sad part is that these mindsets actually begin prior to med school. So they're already existing in those students that are wanting to go for medicine. And then they get more solidified in medicine. And by the time we're attending, we've already accepted that it's absolutely second nature that we can prioritize our health as last. When you think about that, that's a pretty dangerous way to go. I don't know how you guys, if you guys remember, I know none of us are traveling these days, but if you guys, like when you're flying, they always talk about you put the oxygen mask first on yourself before you apply it to anyone else around you. In medicine, we forget that concept a lot. I need to be able to take care of myself before I can help those around me. And that includes my patients. But somehow we've just been okay with, no, it's okay. Like I can do more. I can run faster. I can also do that responsibility. Oh, and that's okay that I'm like squeezing in more patients, which means I'm going to have like now even extra charting to do at the end of the day, which means I'm going to get home later. For whatever reason, we've normalized that that is okay. I'm really glad to see the efforts that are being put in the last few years, that that is actually not okay. We do need to have balance in our lives. I added this last bit here because I just wanted to point this out once again. I know this is a fact that many of us are aware of, and we have probably experienced either, you know, a colleague, a student, someone having struggled with suicide and someone having completed suicide actually. Compared to the general population, physicians are at higher risk and we do have a higher suicide rate. That is a fact. We cannot ignore that. I'm just going to give a moment for you guys to read that. So I remember kind of like smiling and giggling when I had first come across this. I first came across this about 9 months ago. And I shared it with my siblings, but it was like later on as I was reflecting, and I'm like, this is sad. And I remember being, I mean, so I kind of came across this around also my 40th birthday. So too many things were kind of coming together for me at the same time. And I was like, this is sad. I would never want my work to be that defined that even if I like had died and passed over, that all I was focused on was work. Like, I don't want my work to have that emphasis. I am so glad to see that more and more physicians are looking at what is their identity outside of work, that work is not the only identity that they have. You know, we all play multiple roles, but sometimes we prioritize certain roles above others. So I'm glad to see that efforts are being made and efforts need continue to be made where there are various aspects to our identity that need attention and it isn't all about work. At the end of the day, no one's going to care how hard I've worked once I've passed on. And not only that, I could walk away from the hospital right now and that hospital is going to continue running. So as much as I'd like to believe that my role at the hospital somehow keeps it running, that's magical thinking. I solely as one individual do not keep it running, nor am I responsible. If I were to walk away, that hospital is going to continue running. But somehow with our work identity, we've kind of developed this bit of magical thinking, this kind of warped, like I would say maybe a cognitive almost distortion that if we stopped what we were doing, that everything would fall apart. And that is not the case. It's important that we are taking care of ourselves. So we're not coming to the point that we feel so helpless and we're so struggling with our own health because we've ignored it for too long. Okay. So kind of coming into the depressive and anxiety symptoms. From a lot of the surveys, what the data is showing that at least 1/3 of physicians that are experiencing burnout actually are meeting criteria for major depressive episode, so MDE. The unfortunate part, so of that 1/3, only 15% will actually access appropriate treatment. So we already talked about the stigma that gets in the way. We talked about the various reasons that gets in. So now I'm going to actually kind of shift gears to focus on why it's so important that we are addressing our health and our symptoms. So it's important if someone is experiencing depression for it to be treated, right? For it to be appropriately investigated, for any comorbidities to be highlighted and treated, and then for it to be treated. And the treatment, there's a variety of treatments out there. It's not all therapy, it's not all medications, it's not all exercise. There's a variety of ways to address things. So there's a few areas that need to be targeted when we're treating symptoms, okay? First of all, allow yourself to be a patient, okay? Do not engage in self-treatment. Work with somebody, whether you want to work with a counselor, a therapist, your family physician, if you have a psychiatrist, or your specialist in whichever area that you're seeking treatment. So work with somebody, right? Because then you're going to be more accountable. And the main things that I would like to target with number one is compliance. Whatever you choose. So for instance, I'll give an example. If someone recognizes, okay, you know what, I'm kind of having some mild symptoms of anxiety and panic, and I feel like it's interfering, and they want to look at improving, like taking in, how about something like meditation? And that's okay. But we need to be compliant with what we choose, because quite often physicians are the worst for being compliant, especially when it comes to even taking medications. We are the worst. I know we always talk to our patients about compliance, but we are the worst. So whatever route you choose for yourself, whatever that journey is, and that you've done it with another professional, compliance has to be targeted. Now, the fact below, with antidepressants, it is a fact already that 72% will stop their treatment within the first 90 days. Of course, there can be a variety of reasons why treatment is stopped, but we already know if you have a depressive episode and you're stopping your treatment prior to when your physician has advised you to, you're increasing your chance of having a more severe episode within that depression. And that's going to lead to other things. A few slides that are going to come up, I'll be able to explain that concept more. It's also important to target the stigma, to look at your own barriers that you may be posing, but then also pay attention to the barriers that are already in the environment around you. And how are you going to be able to maybe address them? It is not your job to take all of them on. Do not take on another project because you're focusing on taking care of yourself. And the other thing I would say when it comes to depressive and anxiety symptoms, one area that really needs a lot of targeting is sleep. So whether that's through medication, and that can be over the counter medications or prescription medication, looking at your routine, your sleep hygiene. Sleep is so important because it is the only restorative, it's nature's restorative way of resetting our brains. Okay. So I just want to emphasize, the earlier you can treat and optimize the treatment for depression is so crucial, because that's when you're going to be able to reach full recovery, and you're going to be able to reach it actually sooner. So it is important when we're seeing our patients, and even for ourselves, to pay attention if you notice that you may have symptoms that are now beyond burnout, or maybe with depression, or for those that are currently experiencing depression or have in the past, that it's important that the symptoms get targeted earlier, and that we're optimizing that treatment earlier, and we're not just letting people suffer. What are the consequences of delayed treatment? So you guys, I'm sure, have come across this already, but I'll just kind of summarize it. The more you put off treatment, the more you're going to suffer. Okay. So, and that goes for anything, right? If you're not getting that area the attention it needs, the more you're going to suffer in that area. Okay. If we do not treat sooner and we wait, there is a chance that we're going to reduce the chances of reaching an asymptomatic remission, meaning we may still have residual symptoms left. We're going to prolong the time that it takes to actually reach remission. We're also going to potentially reduce the chances of actually having a full functional recovery. We all know that when it comes to depression and prolonged anxiety, like the untreated depressive episodes and anxiety disorders, that you actually have changes in the brain. Okay, so the hippocampus volume being decreased, and this can happen in that very first episode. It does not need to be future episodes that you're seeing it. You can see it in the first episode. The brain is not pruning itself the way it should, so you have the suppressed neurogenesis. Okay, so I don't know if those of you guys that are familiar with BDNF, so that's brain derived neurotrophic factor. Okay, when we're stressed, that factor goes down. That factor is actually responsible for our neurons to continue being healthy. So when it goes down, then we're not having that same turnover and healthier environment that's needed in the brain. Okay. Okay, 1 second. So for looking at that delayed optimization or the delayed access to treatment, there's a few different things that we can look at. So the next 2 slides are going to focus a little bit on kind of medication and what do we do. We can be on an antidepressant and we have not reached not even a partial response. When that's occurred, you got to look at 2 different things. You can either switch medications, or do you continue with the medication, augment it with something else? So according to the CanMed guidelines, so these charts are actually available in the CanMed 2016. That's the latest update to the guidelines, to have a look there. So you can consider switching if it's just their first antidepressant trial. If there's a lot of side effects that they're experiencing, of course, you're going to want to switch because you want to increase the adherence to medication and that compliance. If there's absolutely no response, you look for a response being 2 to 4 weeks after an individual has consistently taken their medication. There should be a partial response. If there is absolutely no partial response at that 4-week mark, that antidepressant is not going to work. So even if you increase the dose, you're not going to get anything out of it because you should have seen a partial response. Oh, and that is if the patient was compliant in taking it. So it is important to double check that they actually took it, because, you know, I have patients, I've given them a prescription, I'm having a follow-up appointment at that 4-week mark. And as I do my digging, I find out that they only filled the prescription 5 days prior to seeing me. And then they're complaining about a lot of things. And at that point, we've got to slow it down. We actually need that optimum time to know if this trial is efficient or not. The other thing is to consider adding something. So according to the guidelines, you can look in considering adding, if they've already been on 2 different antidepressant trials, if they are tolerating the antidepressant, but there's residual symptoms you can target. I am actually a big player in augmenting, and I like to kind of augment right from the beginning. If there's specific symptoms that I can target, I will target those symptoms to give that individual a bit of relief while I'm optimizing the antidepressant. And when I'm augmenting, I'm not looking at my augmenting agent being present throughout the course of the treatment, because that's going to be what the antidepressant will be present for, but the augmenting agent being present enough and long enough for the patient to be fully back in the driver's seat in regards to being able to then engage actively in therapy. For me, the main agents that I will augment with are the antipsychotics that I'm using, and they are level 1. The next slide will show kind of the ranking of where it is, but they are first line antipsychotic medications. And the reason that I'm going to be choosing them is when I have an initial response, I want to boost the effects of that. I don't have to worry about any drug interactions, and I need specific targets of symptoms to be hit. Of course, to always be mindful whenever we are doing polypharmacy, make sure you're always monitoring for side effects, right? Because patient could experience a side effect, and rather than them all of a sudden stopping both medications, it's important that you're monitoring so you can address that. And sometimes cost can play a role depending on what patients' plans are. We are fortunate, most plans do cover most of the antipsychotics and the antidepressants here in Canada. So the agents that I mostly use, so we kind of have the first line, second line. This is once again from the CanMed guidelines. So aripiprazole, known as Abilify, quetiapine, known as Seroquel, risperidone, and brexpiprazole are all level 1. So the common ones that I actually use are Abilify, Seroquel, and brexpiprazole. So I really like Abilify and brexpiprazole for those individuals where rumination is such a big part of their symptoms and that negative self-talk, and it's like they can't turn off their brain at all. I will use these agents to kind of bring that down while I'm optimizing the antidepressant. Because an antidepressant, for it to get to its optimum dose, I'm looking at easily 4 to 8 weeks for that to happen. And I want the patient to feel relief. So I'll use the antipsychotic in between to get some of those things taken care of. And then slowly, as we see improvement, then I'll step off the antipsychotic. Quetiapine, for those that are really struggling with sleep in low doses, it does wonders. Of course, make sure that your patient doesn't have any metabolic syndrome stuff going on already, because you wouldn't want to worsen that for them. So with these medications, with the brexpiprazole, the dosing can be 2 to 15 milligrams. Common doses that I'll use are usually 5 to 10 milligrams. I find that if I hit them with my 5 milligrams, I actually get a better response than I'm going to hit them with 2, and I'm able to overshoot past the akathisia. The lower doses, for some reason, seem to bring on more akathisia. With risperidone, can be 0.5 that I can start with, and I might just go as high as 2. I usually don't go over 2 unless if there was a significant comorbidity that needed to be addressed. And then with brexpiprazole, so 1 to 2 milligrams, but you can go as low as 0.5 if needed. The nice thing about brexpiprazole is known as Rexulti. It is actually showing us some evidence within anxious distress and depression. So this is an area when we know when it comes to anxiety, anxiety can be across all the different diagnoses, right? But with the anxious distress, it is showing some really good evidence. I actually had a patient that had developed a little bit of like TD being on Brex. So I had to step it down, and she actually was resistant with me stepping it down because it was the only medication that actually was helping with the anxiety piece, that where she was like, she wasn't in panic mode all the time. We did step it down because I was like, I can't have your tongue constantly darting. You need to be able to, take in your food and so on. So we stepped it down. We found a balance where the TD is now extremely mild and very manageable for her, and her anxiety is still manageable. Okay. So that was about the medications, but now we're going to talk about the bigger picture here, right? Because it's not all about the medications. Once you get a patient stable enough, or you yourself, if you're in burnout, you have to be at a certain mode before you're going to be able to engage in some of the other aspects. So there's a whole other sea of tools that are available to us, okay? So part of it is going to be looking at our coping strategies, building our resiliency or rejigging it, okay? Looking at behavioral activation, and here I'm going to emphasize that it has to be about a healthy routine, because some of the routines that we are doing that are giving us our sense of purpose are actually interfering with our health. Various grounding techniques that individuals can engage in. And for grounding techniques, there's various things out there. So you can look at some of the breathing, getting connected to your body, doing a wall sit for 30 seconds while you're looking at your senses. So I don't know if you guys are familiar with 5, 4, 3, 2, 1. So that's looking at your senses. So what are the 5 things that you're seeing around yourself? Then what are the 4 things that you're hearing? What are the 3 things that you can touch? What are the 2 things that you can smell? What is the 1 thing you can taste? So this really helps you get out of your mind and to get once again grounded into your body. Because to be able to use our senses, you gotta be then in your body. Different relaxation techniques. So there's quite a bit of data out on breathing, right? So deep breathing, paced breathing, box breathing. So various techniques to be able to bring us down. We are also very fortunate that we have a lot of apps that can help with some of the breathing stuff, and you can follow along. So they'll purposefully, how long is your inhale then versus the exhale. Progressive muscle relaxation. A great way to physically train your body in regards to releasing tension, because you're imposing tension to then release it. And you can do this working your way up from all the way from your toes up to your head. Recently, when I've engaged in progressive muscle relaxation, I don't make it all the way up to my head because I'll end up falling asleep halfway, but at least it's doing its job. It's a great one for those nights where you can have a bit of a struggle for sleep and just kind of relaxing. And I haven't had to go all the way to my head because I've fallen asleep halfway through. Mindfulness. Mindfulness is something that's gotten a lot of attention in the last 10 years. I would say 10, 15 years, and it is very useful for looking not just at depression or anxiety, but just everyday life and building more awareness for yourself. Other forms of meditation. So mindfulness initially had come out as a form of meditation, but now some people see it as a way of life, and I agree with that. So meditation and then medication that we've already covered prior. So behavioral activation, you guys had seen on the other slide. So here is where I wanted to kind of focus a bit more, because I feel like this is an area that is really in our control and sometimes needs our attention once again to reset, because we can develop unhealthy habits. So sometimes we do need to reset things. With routines, it is important that there is balance with them. So you can't just have one routine after another. Your day can't be just fully all about routines. So you need set routines for things. So where I would emphasize routine is necessary is kind of first thing in the morning, getting yourself going. That's important. Get organized for your day so you know what's going on. Any transition that you're going to make. So if it's the day that you're at work, then that transition from work back home. So have a little routine that you need to do so you can transition back into your home life, and you can literally then put your work life away to draw that solid boundary between those, and a bedtime routine. Okay, so transition routines, morning routines, and bedtime routines. These are regular routines that are really helpful to have. With behavioral activation, this pretty much comprises our kind of entire day, right? Because you're looking at the physical activity you're engaging in, how you're nourishing your body and hydrating it, having balance between work and study and your other life responsibilities, how you're engaging with others, and how you're also not engaging with others. It's important to take me time. And sometimes scheduling that in advance can be helpful, because then you'll know for the week, like, okay, I do have these couple of activities that I'm doing that's just about me. And they don't have to be elaborate activities. It could be as simple as I'm going to read that book that, I'm halfway through, or I'm going to, light a candle and have a bath. I'm more of a hot showers rather than baths. So it's whatever works for individuals, and you can try on different things and see what is helpful. I can't emphasize enough, this entire slide is about self-care. It is important that we continue to prioritize ourselves. I have seen physicians, including myself, numerous times. I can rattle off to a patient how they can approach something, how they can improve something, and I'm rattling off all this great advice, and I might only be applying 30% to my life. So since last year, I have actively shifted that I'm actually applying more of what I'm encouraging my patients to do to look at their health. We talked a bit about sleep, so we'll go on to the next slide. So here are some online resources. And then for those interested, I could do like a separate 2-pager. It'll be my slide about the online resources and the medical association resources. I could make that available if that would be of interest. Okay. So some of the online resources, so Anxiety Canada is great, and you actually have PDFs that you can download, and it's for free. So you can use it for your patients, you can use it for your colleagues, whatever. The Breath Project, that's another site to look at. And then I have a couple for parents, addictions, and then there's these online resources, but we also have the advantage of today's era, including multiple apps. So some of these you guys would have already seen. Some of them do require a bit of a fee for the year, but these are some ones that I find have been helpful, and I've tried a few of them. So it's been great. And I think that we are sometimes so attached to our phones that it's useful to sometimes maybe have healthier apps, and so it's not just getting maybe just losing time just on the phone. So when it comes to resources specifically tailored just for physicians, so we have our medical associations, we have our provincial medical associations, and I think it's important that we keep in mind that we can look at these resources, okay? So they're available online, but they also have active phone numbers that you can reach out to. The next 2 pages, I'll have the phone numbers listed, but keep in mind that you have additional resources around you. You have your trusted colleagues. You're not in this alone. Quite often, others are also experiencing similar stress, because when it comes to the demands at work, we're usually all experiencing them at the same time. You have your family physician as a massive resource. And not only that, but also your specialist that you can work with. And on top of that, I'm hoping that you'll have your enhanced survival kit, because my hope is that you guys already had a survival kit, but now we're just going to be enhancing it after today. Okay, so most of the provincial medical associations do have individual hotlines. They have full-on websites, so you can reach out to someone, and they're really good about getting back to individuals kind of within that 24-hour frame. And then there was a few of them that have like a joint kind of, it was the CMA Wellness Support Line. And that was for the territories along with Saskatchewan and Labrador. Okay. I just realized that it is 6:03. So I'll ask the group, because I do want to be respectful of your time. I was hoping to do breakout rooms for 5 minutes so you guys could actually amongst yourselves discuss your survival kits. Is that something you guys want to do, or should we shelf this so I can finish at an appropriate time? Because this hour is for you guys. We're over the hour, sorry. Oh, I think individuals might be trying to speak, but I don't hear anything. Okay, perfect. So people said, let's move towards finishing, save it for later. Okay, so after the talk, please take time to enhance your survival kits, and I'll focus on my survival kit so you have a bit of a framework. So when I was looking at, so every few months I'm having to kind of shift my survival kit. So when I'm looking at it, there's a few things that I look at. What does it look like visually for me? How does it feel to touch? Is it something that I can hear? What does it taste like? Does it have a smell? And that's actually helped me really enhance my survival kit. because there's a whole bunch of things that are necessary. So this was me grabbing a couple of the images of the things that are important to me. I love my tea, I love my chocolate, I love my gratitude journal, and I love blankets, and then having kind of small textile things to be able to feel. So this just summarizes, so for me, like journaling, coloring, reinforcing my boundaries, having regular times to unplug from my phone and the screen, engaging in stretching, having regular massage therapy. That's something that I've been now doing regularly since August, August 2020. I don't understand why I didn't do it earlier. It's been great. And then interpersonally, I'm really focused on who are my core people and who can I go to for what support. And it's just not my family members. I'm talking about my work family as well. And it's important to identify that for yourself and then to keep connected with people. And among that, a lot of the time, some of the things that really help is doing some virtual gatherings, connecting with other people, just doing games nights, and just supporting one another. And the other thing I gotta say that I've been consistently now doing is personal training since August. A world of difference adding some of these newer tools to my kit. So some of the reflections as you guys focus on your survival kit would be to regularly step back from your routine and your life and evaluate it and see, is it in line with your goals and your values, right? And this is something that, you know, I think weekly for some people might be intense, but if you're newly building a routine, then please do it weekly to evaluate it for yourself. Otherwise, that monthly check-in with yourself, I think, is good. And then make sure that you're taking on those types of responsibilities and tasks that actually align with your goals and values. So of course, we can't just change our work life, you know, just overnight, but it's important to know what are your goals and your values, and then what are you actually doing that is aligned with that. And then some things, of course, we have to do because we need that financial security. And then within the mandatory tasks that you have to do, always look for ways how you can improve your efficacy so you're not bringing that work home. So you can leave it, like transition away from it once you're done. Keeping yourself organized, as you guys know, it's so important that we are keeping ourselves organized and scheduled, because that's the only way that we're going to be able to have that balance. And then I've already emphasized how self-care is absolutely crucial, to have open and honest communications with yourself and also with your loved ones. This is a way that you'll actually keep yourself accountable. And the last thing I'd like to say is that don't hesitate to reach out for help, and then don't hesitate to reach out to someone that you think that might be struggling, just as a check-in. And you don't have to bring up their struggles. You can just check in with them. How are you doing? That simple question can lead into all sorts of meaningful conversations. And I'd like to say, just make sure, try on different techniques and styles, see what works for you. And not all the techniques are necessarily going to work for everyone, but figure out what works best for you. On that note, I'm going to end the formal part of the talk, and then I'll open it up to questions. So I believe Maya did pass away last year, but her poem, Phenomenal Woman, I love her poem. So I was just saying, it's in the reach of my arms, the span of my hips, the stride of my step, the curl of my lips. I am a woman, phenomenally. Phenomenal woman, that's me. That's just a little clip of her poem. All right, I'll open the floor to questions.
Hi, my name's Rachel Vogler. I'm a family physician in Vancouver, BC. And thank you. That was excellent. It's very helpful talk and so appropriate right now. I suppose I have a comment more than a question. I'm a family doctor to a number of physicians, and also I'm sitting on our somewhat newly formed physician wellness committee within our health authority.
Mm-hmm.
And I think one of the things that it's really important to emphasize when thinking about physician wellness is that for many of us, some of the issues are so much bigger than us, like this, it's the system factors. And so when faced with a colleague who's struggling, I think the idea of being like, oh, here's a chocolate bar, that'll make you feel better, right? Like it's so, not recognizing the bigger picture. And so one of the things that our wellness committee is focusing on is looking at the system issues, like how do we make it so we had a meeting last night and talked about the pebble in the shoe problem. So like every time the form is lost, every time you can't connect with the specialist you're trying to call, all those little things that add up. And so looking at how as a whole, like working with leadership, working with the whole organization to actually correct these things and recognize that our own health will be improved and that medical errors will go down and all kinds of things will be better. And so I think it's really important for each individual to say there's all the things that you can do. So yes, please go to bed and try not to stay on Facebook all night and do yoga and don't eat too much junk food, but that it doesn't all lie within one individual.
Yeah, absolutely.
And not to be, and that's a hard thing to say to people, like you should take on your organization and make them totally change everything, or they should give you a job where you only work once a week. Like that's not always realistic. But so I guess my question for you is how do we feel, how in your experience, how do you support, if somebody comes to you as a physician who's struggling, how can you support them to go back to their organization to see change happen?
So Rachel, you bring up a really good point. And I mean, you're talking to a physician. I'm in Alberta. We don't, like our government, we don't even have a contract, so definitely a lot of things that are kind of within the system. And I purposefully for this talk did leave that out because that I feel like is such a different arena. But I mean, I am actively involved on the AMA. I'm the rep for general psychiatry, and then also kind of just actively involved with CAMS and so on, and just representing and being a physician advocate, because I do feel that we need changes in our system that are sustainable, where physicians' voices are, first of all, respected and their expertise is actually taken into account. Because when we're constantly dealing with systems that are making these changes around you without even consulting you, it's almost like it's disrespect on disrespect on disrespect. And I do think that as physicians, we do have a lot of power to come together. And with that, I believe it is the communication. Right now, I find that social media, especially for Alberta, I can speak to that, like it's really unified a lot of physician voices together, because we're being able to communicate that we're feeling the similar things. How are we going to stay united with what the government's been wanting to do to us? So in having that open communication. With that, I would still say that it is important that we don't take on too much. We take it on accordingly, but at the same time, we can't take it fully on. So I don't know I think you guys have Doctors of BC out there, right? Yeah. So do you guys also have an organization that's just within Doctors of BC that are just physician advocates?
Yeah, we have a number of different structures that are working to support physicians. Yes.
Yeah. And I think that that's important, that we continue working on those and then keeping them also more accountable. So it's good to have a structure and a system, but how do you go back to these structures being accountable? And sometimes it's good to look back at the system as, where are we building in that accountability factor? And because I know that that has been an area of focus within the last 3 years, at least for Alberta. I don't know what it looks like in BC, because I think that that's going to be also important. And then to sometimes look at, what are the mission statements? What are these teams actually doing? And what are we going to be accountable for? And trying not to bite too much at the same time. But we are kind of in an interesting state of politics, I would say, across Canada, because what's going on in Alberta, depending on how this goes, it could happen to other provinces too. And other provinces have already experienced things prior to us. But that was a very good point. Thank you for bringing that. Any other questions? I don't see anything in the chat group. It is 6:15 and I do want to be respectful of your guys' time. Oh, sorry, someone's saying something?
Oh, sorry, Manrit, I just wanted to say, like, just in comment to that, like, it sounds a lot like it's very frustrating to work despite certain system issues. And I think I just wanted to bring up something that you actually told me last summer, and I thought was useful to deal with these types of system issues that sometimes are frustrating people, and not necessarily the system, but just the situation itself. And you said, you got to learn how to roll with the resistance. And I wrote that in my journal. I have a gratitude journal as well, but that was before, actually years before we met, actually. And you said this summer, you were like, okay, Helene, just learn to roll with the resistance. And I just remember writing that down. I'm like, Manrit, I'm rolling with resistance. And you're like, okay. But as funny as that can be, it's just, sometimes there are things like, my other friend actually that same week sent me this serenity reminder. I call it the serenity reminder, but it says, grant me the wisdom to know what I can change, and the courage to change it if I can, or something like that. And the wisdom to know the difference, things that I can't change. So just being able to roll with the resistance, maybe in a different talk, you can talk a little bit more about that in a next talk, or maybe you can speak a little bit to it now. But I just thought that was very nice way to think through certain situations to add on to the CBT type of mindset.
Yeah, so rolling with the resistance comes under actually motivational interviewing. And the thing is, there are so many things that are kind of sometimes beyond our control, and it's with the system, but I find that that's where it's building that network and having the alliances. So, because you can make small changes and they will make an impact, but it does take time. Oh, and believe me, there are times where we all feel like we're just banging our head against a brick wall. When that happens. Thank you for all the lovely comments. I was just reading through them, and I'm going to wish all of you guys best of luck with your survival kits, and also with your tribe of women around you, whether they're physicians, your family members, or other team members, because it is the team around us that is very helpful. And you know what? The men also help out. I gotta say, I rely on my partner for a lot.
Thank you.
Thank you, Manrit. Thanks everyone for attending.
Have a good night.
Thank you. Good night.
And Manrit, you look phenomenal. Well done.